Good afternoon and welcome to the Committee on Health and Human Services. Secretary, will you call roll, please?
Assembly members Dahlia, here. Edgeworth, here. Gonzalez, here. Goulding, here. Gray,
still here.
Hafen, here. Hibbets, here. Hunt,
here.
Jackson,
barely here.
Koenig, here. Nadeem, Wynn, here. Orntlicker, here. Chair Brown-May.
Here, thank you. Okay, today we are all about work session today. Thank you so much for being here. Instead of going through all of our typical housekeeping items, just remember to silence your cell phone or electronic device. We're going to get really busy. It is not customary during a work session meeting to rehear a bill, although we do have a number of experts in the room, so if we do have questions, we may call someone up for clarification. We have 23 measures today for consideration. So I want to say thank you to all of you on the committee, all of our staff, for all of your hard work to get us here. And we will be kind to our committee staff today. Mr. Florence, you may begin.
Thank you, Madam Chair. For the record, Davis Florence, Committee Policy Analyst. I would just like to remind the committee that as nonpartisan staff, I can neither support nor oppose any measure before you today. The first bill on work session is Assembly Bill 220, which authorizes the issuance of identification cards by the Department of Health and Human Services to persons experiencing homelessness under certain circumstances. This was sponsored by Assemblymember Hunt and was heard on March 3rd. There was an amendment submitted by Assemblymember Hunt, which proposes to remove the requirement in subsection 2 of Section 8 that the identification card comply with the Real ID Act. And there are no other amendments. Thank you, Chair.
Thank you, Mr. Florence. Members, are there any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Vice Chair Wynn, second by Assemblymember Gray. Is there any discussion on the motion? No discussion. All those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give that floor assignment to Assemblymember Hunt. Next is Assembly Bill 221. Mr. Florence.
Thank you, Chair. For the record, Davis Florence. Let me get back to it. Assembly Bill 221 exempts certain offices of physicians and other health care facilities from certain permitting requirements relating to anesthesia and sedation. This was sponsored by Assemblymember Edgeworth and was heard on March 3rd. Assembly Bill 221 exempts a physician's office or healthcare facility from the requirement to obtain a permit from the Division of Public and Behavioral Health if the office only administers general anesthesia, deep sedation, or conscious sedation. This exemption applies if the administration is performed by a physician who is licensed to practice dentistry, holds a permit issued by the Board of Dental Examiners, and administers within the scope of that permit. And there are no amendments to this bill. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I will entertain a motion to do pass Assembly Bill 221. Second. Motion by Vice Chair Wynn, second by Assemblymember Gonzalez. Members, any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. All opposed, nay. Motion carries unanimously. Thank you. And we'll assign that floor statement to Assemblymember Edgeworth. Thank you. Next on our agenda, we have Assembly Bill 282.
Thank you, Chair. Davis Florence for the record. Assembly Bill 282 provides provisions relating to billing for health care. This measure was sponsored by Assemblymember Orntlicker and was heard on March 5th. Assemblymember Orntlicker submitted the attached amendment, which proposes to revise Section 2 and subsections 1 and 2 of Section 3 to instead require a medical facility or healthcare provider that receives an overpayment from a patient to refund the overpaid amount no later than 60 days after it has been determined that overpayment was made. Additionally, if a patient believes a billing error exists and notifies the facility of the specific charges being disputed, the facility, within 30 days of receipt, must respond to the patient's concerns, advise the patient that more time is needed to investigate the disputed charge, or refer the patient to the Office for Consumer Health Assistance. Additionally, during the review of a potential billing error, a patient shall not be billed for the disputed charge, but they may be billed for other portions of the patient's stay or treatment. Additionally, in Section 2, This adds that a violation is only subject to administrative penalty established by regulation by the State Board of Health. And then lastly, remove Section 1. And that is it, Chair. Thank you.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? Seeing none, I will entertain, all in favor say aye. Aye. Any opposed, nay? Nay. Will the nays please raise their hands? Thank you. Assemblymember Gray, Assemblymember Koenig, Assemblymember Edgeworth, Assemblymember Hafen, Assemblymember Hibbets are nays. This motion does carry. Thank you. We'll give this floor statement to Assemblymember Ornlicker.
Thank you, Chair.
Thank you. Next is Assembly Bill 297.
Thank you, Chair. Davis Florence for the record. Assembly Bill 297 creates a program for the postnatal visitation of certain persons who have recently given birth. This measure was sponsored by Assemblymember Nadeem and was heard on April 9th. Assemblymember Nadeem submitted the attached amendment, which proposes to replace the current language of the bill to instead require the Division of Healthcare Financing and Policy to seek any and all federal authority necessary to establish Medicaid coverage for home visiting services for beneficiaries during pregnancy, birth, and postpartum periods. Secondly, it requires the Director of DHHS to include Medicaid coverage for home visiting services as requested by the recipient. And then bullets 3 and 4 add co-sponsors to the bill. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? Question, go ahead, Assemblymember Koenig.
So I've heard the intent that it's supposed to be the opt-in, but last time I checked on Nellis, it wasn't there. Can I just get a verification that at this point that bill is an opt-in?
Mr. Florence.
Thank you, Chair. Davis Florence for the record. The language in subsection 2 was amended and should be available in member copies. And I think the new amendment should also be in the member packets and uploaded, and includes language that seeks to make the services optional for recipients that request them.
Thank you. So at this point, I will be a yes, pending, reserve my right that if I don't see that amendment on Nellis, then I have, I reserve, the word I couldn't come up with, reserve the right to change my vote.
Thank you, Assemblymember Koenig. We do have an expert in the audience, if you don't mind. We'll call up Administrator Weeks, who can further clarify.
Good afternoon, committee members. Chair Stacy Weeks for the record. In the amendment, as you will see on the back side, it reads that the division shall seek any and all federal authority necessary to establish coverage for home visiting services as an optional service for Medicaid beneficiaries. It also includes new language that says the division shall ensure eligible Medicaid beneficiaries receive notice that home visiting services are an optional health care service covered by Medicaid. No Medicaid beneficiary shall be required to receive home visiting services during pregnancy, birth, or postpartum periods. And that is the amendment. Thank you.
That answers my question. Thank you.
Thank you, Administrator Weeks. I appreciate that. Members, any other questions on this measure? No. Thank you. Okay, seeing no additional questions, I will entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Hunt. Is there any discussion on the motion? All in favor say aye. Aye. Any opposed, nay? Nay. A single nay by Assemblymember Hafen. A nay by Assemblymember Gray. Motion carries. Thank you. We'll give this floor statement to Assemblymember Nadeem. Next on our agenda, members, is Assembly Bill 304. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 304 creates a pilot program relating to electromagnetic brain pulse treatment. This was sponsored by Assemblymember Karras and was heard on March 10th. Assemblymember Karras proposed an amendment to replace the required pilot program and instead, one, authorize DHHS to the extent that funding is available and using existing personnel and technology to gather voluntary data on the outcomes and best practices from people or private entities currently providing transcranial magnetic stimulation or electromagnetic brain pulse treatment. And secondly, public or private research institutions conducting studies on TMS or EMBP for substance use disorder, post-traumatic stress disorder, or gambling disorder. And second, this requires DHHS to publish a report of any findings and recommendations based on the data that is voluntarily submitted on or before July 1st, 2027. The department must publish the report on its internet website and submit it to the Joint Interim Standing Committee on Health and Human Services. Additionally, members, there was an amendment submitted later from Assemblymember Karras that seeks to add a few co-sponsors, and those co-sponsors include Senator Hansen, Senator Pazina, Assembly Members Anderson, Dahlia De Silva, Gray, Hansen, Hibbets, Jackson, Kasama, Zermeno Moore, Nadeem, and O'Neill. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. Okay, we have a motion by Vice Chair Nguyen. We have a second from Assemblymember Gray. Is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thank you. We'll give that floor statement to Assemblymember Karras. Next on our agenda is Assembly Bill 315. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 315 requires applications to participate in Medicaid as a provider to be notarized. This was sponsored by Assemblymember Edgeworth and was heard on March 10th. Assembly Bill 315 requires that an application to participate in Medicaid as a provider be notarized. And additionally, Assemblymember Edgeworth, in consultation with Stacy Weeks and Chelsea Capurro, proposed the attached amendment that amends subsection 2 of section 1 to require verification of a provider's identity and signature through one of the following measures. First, verification by oath or affirmation before a notary public or another person authorized by law to administer oaths. Or secondly, electronic identity verification through a state-approved authentication system that verifies the provider's identity and electronic signature using a multi-factor authentication or other secure messages. And then finally, this amendment adds definitions for electronic identity verification and notarization. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Dahlia. Is there any discussion on this motion? Seeing none, all in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give that floor statement to Assemblymember Edgeworth. Thank you. Next on our agenda is Assembly Bill 326. Mr. Florence.
Thank you, Madam Chair. Assembly Bill 326 revises provisions relating to the designation of hospitals as centers for the treatment of trauma. This was sponsored by Assemblymember Koenig and was heard on March 12th. Assemblymember Koenig proposed the attached amendment, which replaces the original language of the bill. Instead, the amendment requires DHHS to conduct a comprehensive statewide study to consider the future trauma needs of the state, including plans for the development and designation of new trauma centers, as well as the inclusion of a trauma level 4 designation. The department may apply for and accept any sources of funding to carry out this study. Additionally, Assemblymember Brown May proposes an amendment to require the disclosure or require a disclosure in the study to include the name of any person and the amount of any gift, grant, donation, or other money given by a person for the purposes of the study. And second, requires DHHS to provide for a properly noticed time frame for collecting written public comment on the study. And that is the last amendment, Chair. Thank you.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Assemblymember Gray. Second by Assemblymember Dahlia. Is there any discussion on this motion? Seeing none, all those in favor say aye. Aye. Any opposed, nay? Nay. Will nays raise your hand, please? Nay, Assemblymember Hunt. Motion carries. Thank you so much. We'll give this floor statement to Assemblymember Koenig. Next on our agenda, Assembly Bill 343. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 343 makes revisions relating to healthcare. This was sponsored by Assemblymember Yeager and was heard on March 19th. AB 343 codifies federal hospital price transparency regulations, among other provisions. Martin Fitzgerald submitted an amendment which proposes to, 1, revise the definition of medical debt, and 2nd, remove the ability of the Division of Public and Behavioral Health to revoke a license for failure to comply with the provisions of this bill. Additionally, Paul Mordecon, on behalf of the Vegas Chamber, submitted the attached amendment which proposes to, first, replace subsections 3 through 5 of Section 17 to instead require and make it a violation of Chapter 598, which is the Deceptive Trade Practices Act of NRS, for a hospital to knowingly be in violation of the act. Second, allows a medical debtor who believes a hospital has taken an action described in subsection 2 in violation of subsection 1 to file a claim of a violation of the Deceptive Trade Practices Act with the Bureau of Consumer Protection of the Office of the Attorney General and to notify the hospital they are disputing the charge. Third, it requires the governor's consumer health advocate to assist the consumer with filing a complaint. And then next, a hospital is prohibited from the following actions while a claim is being disputed by the Bureau of Consumer Protection. A hospital may not refer the medical debt to a collection agency. They may not file a civil action or seek arbitration to collect the medical debt. And third, they are not able to directly or indirectly cause the reporting of the medical debt to a reporting agency. A hospital is required to extinguish a charge and the related debt and refund any payments made by the medical debtor if the Bureau of Consumer Protection sides with the claimant. And finally, this new Second Amendment revises Section 18 to require the department to adopt regulations to carry out the provisions of Sections 17 through 21. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Vice Chair. Oh, pardon me, I'm sorry. We have discussion. Assemblymember Hafen.
Thank you, Chair. I want to thank the Speaker for the amendments that are in here. I think it's getting really, really close, but not quite there yet. I think we all believe in transparency and want to see things done in that arena. So I want to thank the Speaker. Right now I'm going to be a no, but hopefully by the time it gets to the floor, the amended language will be good. So thank you.
Thank you. Just for clarity, for the record, we had a motion to amend and do pass by Vice Chair Nguyen and a second by Assemblymember Gonzalez. Assemblymember Hafen's statements were then in discussion. Is that correct? Discussion. Yes, thank you. Assemblymember Edgeworth, do you also have discussion on this?
Just a ditto with Assemblymember Hafen.
Thank you. Is there anyone else? Okay. All those in favor say aye. Aye. Any opposed, nay? Will the nays raise your hands, please? Assemblymember Koenig, Assemblymember Edgeworth, Assemblymember Hafen, Assemblymember Hibbets, and Assemblymember Gray are nay. The motion does carry. Thank you. And we will assign this floor statement to Vice Chair Nguyen. Okay, our next measure for consideration is Assembly Bill 350. Mr. Florence?
Thank you, Chair. Davis Florence for the record. Assembly Bill 350 revises provisions relating to cemeteries. This was sponsored by the Assembly Committee on Judiciary and was heard on March 21st. AB 350 provides that a cemetery authority shall not disinter or remove certain human remains without a court order. This bill additionally establishes rules a cemetery authority must follow to maintain the cemetery in an orderly condition. Kayla Maes, civil rights analyst with the ACLU of Nevada, proposed the attached amendment, which does the following. First, it exempts a coroner and a public health officer or a person authorized to order burial pursuant to NRS 451.024 from the requirements to obtain a court order. Second, it adds amendments that require the party seeking exhumation to do, which can be found in sub A through C. And then third, it amends section 5 to revise the upkeep standards for a cemetery to be considered in an orderly condition. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on the motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thanks. We'll give this floor statement to Assemblymember Hunt. Next on our agenda is Assembly Bill 352. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 352 revises provisions relating to businesses. This was sponsored by Assemblymember Anderson and was heard on March 17th. AB 352 requires the State Department of Agriculture to license cottage cosmetics operations and sets forth requirements and fees related to cottage cosmetic operations. This bill also transfers the regulatory authority over cottage food operations to the department and increases the gross sales limit to no more than $100,000. Acidified foods, which craft food operations are authorized to produce, are added to the list of allowable food items a cottage food operation may produce, while repealing provisions concerning craft food operations. Assemblymember Anderson submitted the attached amendment, which proposes to first define a list of cosmetic products allowed for production by cottage cosmetic operations. Second, it clarifies that nothing in this act prohibits a local zoning board, planning commission, or governing body of an incorporated town, city, or county from regulating the time, place, and manner of cottage cosmetic operations or food operations. Third, it removes acidified foods from the list allowed to be prepared by a cottage food operation. And then in 4, restores the originally deleted language concerning craft food operations. Fifth, it increases the gross sales cap for craft food operations to $100,000 and authorizes sales transactions by telephone or internet with fulfillment required to be in person. And then 6, remove section 5 and canning from subsection 3C of NRS 587.695. And finally, in NRS 587.696, it removes the training course and examination from the list of items the department may charge a reasonable fee for. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? No discussion. All those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give this floor statement to Assemblymember Anderson. Next on our agenda, Assembly Bill 368. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 368 revises provisions governing electronic communication devices in certain healthcare facilities. This was sponsored by Assemblymember Carter and was heard on March 21st. AB 368 authorizes a patient in any assisted living facility to install electronic communication device under the same conditions as existing law establishes for a patient in a skilled nursing facility. Assemblymember Carter proposed an amendment to add the relevant provisions of the bill to Chapter 435, which is Persons with Intellectual Disabilities and Developmental Disabilities of NRS, to allow people living in a facility operated by supported living arrangement providers to install communication devices in their living quarters, and to prohibit a supported living arrangement provider that provides services in a person's home from refusing to deliver services to a person who has an electronic communication device installed in his or her home. Additionally, Assemblymember Brown May proposed an amendment to revise Section 3 to include a unit in a living community for people with disabilities for the provision of assisted living services, or a living community for people with disabilities that provides only assisted living services. And finally, to add a definition for living community for persons with disabilities. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Hunt. Any discussion on this motion? No discussion. All those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give that floor statement to Assemblymember Carter. Next on our agenda, Assembly Bill 378. Mr. Florence.
Thank you, Chair. Assembly Bill 378 creates the Alternative Therapy Pilot Program. This was sponsored by Assemblymember Carter et al. And was heard on March 26th. AB 378 creates the Alternative Therapy Pilot Program to be administered by the Division of Public and Behavioral Health. Assemblymember Carter, in coordination with DHHS, submitted the attached amendment, which proposes to first replace honorably discharged with general discharge. Second, add provisions stating DHHS, its officers, and employees do not warrant or guarantee the success, safety, or any particular outcome of any alternative therapy provided under the program. The department and its officers are immune from any claim based on an alleged breach of such a warranty or guarantee. Third, DPPH is required to create an advisory panel composed of medical professionals, representatives of relevant state agencies, and other stakeholders to provide oversight regarding the financial viability, development, implementation, and evaluation of pilot clinical programs under the pilot program, and to provide quarterly reports to DHHS regarding the operations. Fourth, it requires DPPH to adopt regulations to ensure each patient who provides in a pilot clinical program receives a plan for continued care following participation, and to require DPPH to approve a continuation of care plan. And then finally, the amendment authorizes DPPH to require the entity operating the Alternative Therapy Pilot Program to reimburse the inspecting and certifying agency for the costs incurred. Thank you, Chair.
Thank you, Mr. Florence. Questions? Assemblymember Gray?
Thank you, Madam Chair. I wasn't aware that they had made that amendment to that. I want to clarify one that it says general. That's not going to be applied to just general discharges, and also some of our worst PTSD victims have got under less than honorable, other than honorable, and bad conduct discharges. I don't think we should be exempting them because a lot of those guys were put out of the service because of conduct related to their PTSD, and those are some of the guys that need this treatment the most. So I'd like to work with I'll vote to get it out of here today, but I want to work with the sponsors of the bill to just make sure it's people discharged from the military with a diagnosis of PTSD.
Thank you for your comment. That wasn't a question, though. That was a comment. Thank you.
Yeah, I'm sure there was.
Okay, seeing no other questions, I'll entertain a motion to amend and do pass. A motion by Vice Chair Nguyen, second by?
Second.
Oh, Assemblymember Hibbets. All those in favor, is there any discussion on the motion? Now that we've had discussion on the motion in the form of a question? Okay, no further discussion on this motion. All those in favor say aye. Aye. Any opposed, nay? Nay. Assemblymember Hafen is a nay. Okay, the motion carries. Thank you so much. Thank you. Next on our agenda, a floor statement to Assemblymember Carter. Thank you for the reminder. Next on I lost it with the discussion versus the question. Assembly Bill 395 is next on our agenda. Mr. Florence.
Thank you, Madam Chair. Davis Florence for the record. Assembly Bill 395 revises provisions relating to services to persons who are deaf or hard of hearing. This was sponsored by Assembly Members Roth and Brown May and was heard on March 26th. AB 395 requires healthcare providers and certain medical facilities to ensure each person who is deaf or hard of hearing and seeks care services is notified that a qualified sign language interpreter is available. Assemblymember Roth submitted the attached amendment, which proposes to, 1, require a health facility and healthcare provider to notify each person who is deaf or hard of hearing and seeking care that a qualified sign language interpreter can be made available, along with the other types of accommodations that are available. Second, it clarifies provisions regarding in-person interpretation services, requiring a health facility and healthcare provider to make a good faith attempt to procure an in-person interpreter and retain documentation about that attempt. Additionally, an in-person interpreter must be provided for a pre-scheduled encounter with at least 48 hours notice or within 2 hours of an unplanned inpatient hospitalization. Third, this amendment revises Section 1 and Section 8 to state that a health facility and healthcare provider shall determine the provision of a qualified sign language interpreter remotely using audio-visual communication technology is adequate, provided that the transmitting device has clear audio and visual transmission and can be utilized hands-free. Fourth, it revises the definition of qualified sign language interpreter. Fifth, it adds a new subsection in Section 1 and Section 8 stating the provisions only apply to a facility located in a county with a population of 25,000 or more. Sixth, it removes subsection 4 of Section 1, Section 6, and subsection 4 of Section 8. And then seventh, it exempts emergency medical personnel from the provisions of this bill. And finally, it requires the Division of Public and Behavioral Health to compile and post on its website a list of qualified American Sign Language interpreters in the state. Thank you, Chair.
Thank you, Mr. Florence. Questions, members? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? Assemblymember Hafen.
Thank you, Chair. I want to thank the bill sponsor for all the work that's gone into this. Again, this is getting very, very close. I think there still needs to be a couple of tweaks. I'm going to be a no right now, but I do have hope that it will get to a yes by the time it hits the floor, because I just think that there just needs to be one or two tweaks in this. But right now, I have to be a no.
Thank you. Any other discussion on this motion? Seeing none, all those in favor say aye. Aye. All opposed, nay. Assemblymember Hafen is a nay. Motion does carry. Thank you. We'll give that floor statement to Assemblymember Roth. Next on our agenda, Assembly Bill 482. Mr. Florence.
Thank you, Madam Chair. Davis Florence for the record. Assembly Bill 482 revises provisions relating to Medicaid. This was sponsored by the committee and was heard on March 31st. AB 482 requires the state plan for Medicaid to cover voluntary sterilization of men, clinical services related to contraceptive drugs, devices, and services, and to cover the cost of language translation services provided to facilitate the provision of contraceptive drugs, devices, and services. Additionally, this bill requires the Division of Healthcare Financing and Policy to develop a methodology establishing a compensation rate for translation services that is cost-effective and comparable to the rate paid by other governmental entities. Lastly, the bill requires Medicaid coverage for certain contraceptive services when provided by any healthcare provider for whom the services are within their scope of practice. And there are no amendments to this measure. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I will entertain a motion to do pass by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give this floor statement to Assemblymember Gonzalez. Thank you. Next on our agenda is Assembly Bill 483. Mr. Florence?
Thank you, Chair. Davis Florence for the record. Assembly Bill 483 provides for priority review of certain applications for licensure to practice health professions. This was sponsored by the committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on April 9th. AB 43 requires each agency or licensing board that regulates the licensure or certification of healthcare providers to establish a process for prioritizing the review of applications if that applicant demonstrates that they will be providing in a historically underserved community. And there are no amendments to this bill. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I will entertain a motion to do pass. Motion by Vice Chair Nguyen, second by Assemblymember Hunt. Is there any discussion on this motion? Assemblymember Gray.
Thank you, Madam Chair. I liked the way the bill was presented, but then we were told it was going to look at census tracts based on income and stuff. And a lot of the rurals, especially in my district, were totally exempted from this plan. So at this time, I can't vote for it as it's leaving out a lot of the rural areas.
Thank you. Any other discussion? Assemblymember Hafen.
And I'll just add to my colleague, I was hoping that it would be medically underserved areas, not based on census tracts, and therefore most of my district, I believe, is being left out of this area, which is clearly very medically underserved. And so I will be a no as presented today.
Thank you, members. Any other discussion? Seeing no other discussion, all those in favor say aye. Aye. Any opposed, nay? Nay, please raise your hand. Thank you. Assemblymember Hafen, Assemblymember Hibbets, Assemblymember Edgeworth, and Assemblymember Gray are nay. The motion does carry. We will give this floor assignment to Assemblymember Nadim. Thank you. Next on our agenda, members, Assembly Bill 514. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 514 provides for Medicaid coverage of certain mental health services. This was sponsored by the committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on April 4th. Assemblymember Jackson, in coordination with DHHS, submitted the attached amendment, which proposes to require DHHS to include rehabilitative residential mental health care under Medicaid coverage instead of the originally written care through a therapeutic group home. Additionally, Medicaid coverage for rehabilitative residential mental health care does not include payment for room and board. And second, it includes a definition of this type of care. And third, it includes a new section that requires the State Board of Health to adopt regulations applicable to providers of rehabilitative residential mental health services, which include distinct requirements for providers serving children or youth and those who serve adults. Thank you, Chair.
Thank you, Mr. Florence. Any questions, members? Seeing no questions, I will entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? Assemblymember Hafen.
Thank you, Chair. Assembly Bill 514, I think is a great bill. I did have some concerns brought up to me this morning about possible contradictions to federal regulations. I'm going to vote this out of committee today. I want to reserve my right just to make sure that I can get clarification that the amendments don't have any issues when it comes to federal regulations. Thank you.
Thank you. Members, any other discussion? Seeing none, all those in favor say aye. Aye. Any opposed, nay? Motion carries unanimously. We'll give that floor statement to Assemblymember Jackson. Next on our agenda, Assembly Bill 515. Mr. Florence.
Thank you, Chair. Assembly Bill 515 revises provisions relating to adoption assistance programs. This was sponsored by the committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on April 2nd. AB 515 requires the Division of Child and Family Services to base the amount of a categorical grant on the adoption savings calculated for the immediately preceding fiscal year pursuant to federal law. The bill also authorizes money identified as savings to be carried forward to the next 2 fiscal years before the money reverts to the state general fund. Joanna Jacob, the Government Affairs Manager for Clark County, submitted the attached amendment, which proposes to clarify that adoption savings must be used for any costs associated with providing child welfare services in a manner consistent with the requirements and restrictions of federal law. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I'll entertain a motion to amend and do pass. A motion by Vice Chair Nguyen, second by Assemblymember Hunt. Is there any discussion on the motion? Assemblymember Hafen.
Thank you, Chair. Similar to Assembly Bill 514, I have the same concerns with 515, but I do believe that the amendment does address the concerns there. So I'm going to vote this yes out of committee. Look forward to the final language on the floor just to verify that it is consistent with the requirements and restrictions of the federal law. Thank you.
Thank you. Any other discussion, members? Seeing no discussion, all those in favor say aye. Any opposed, nay? Motion unanimous carries. Thank you. We'll give that floor statement to Assemblymember Dahlia. Next, we have Assembly Bill 516. Mr. Florence?
Thank you, Chair. Assembly Bill 516 revises provisions relating to Medicaid coverage for certain health services provided to children at schools. This was sponsored by the committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on April 4th. AB 516 requires the Director of DHHS to take any action necessary to ensure local and state educational agencies can receive reimbursement for health services that are covered by Medicaid when provided on school premises to children who are recipients. The Director must establish incentives for certain providers to enter into an agreement with a school district, a charter school, or Nevada's Department of Education to provide health services. This bill also establishes the School Health Access Resource Center within the division for the purposes of assisting Medicaid providers in billing Medicaid. The director of DHHS must apply for the necessary federal authority to increase the below rates. And there was an amendment submitted by Assemblymember Dahlia, which is attached to this, and members should have a copy, which proposes to replace school districts and charter schools to instead say local educational agency throughout the entire bill. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Dahlia. Is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay? Nays, please raise your hands. Thank you. Assemblymember Hafen, Assemblymember Hibbets, Assemblymember Gray, Assemblymember Koenig. Motion carries. Thank you. We'll give that floor statement to Assemblymember Hunt. Next on our agenda, we have Assembly Bill 518. Mr. Florence?
Thank you, Chair. Davis Florence for the record. Assembly Bill 518 revises provisions relating to the interstate placement of children. This was sponsored by the committee and was heard on April 2nd. AB 518 adopts and enters into the revised version of the Interstate Compact on the placement of children, and there are no amendments to this bill. Thank you, Chair.
Thank you, Mr. Florence. Any questions on this measure? No, seeing no questions. I will entertain a motion to do pass. Motion by Assemblymember Gray. Second by Assemblymember Dahlia. Is there any discussion on this motion? No. Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thank you. We'll give this floor statement to Assemblymember Goulding. Thank you. Next on our agenda, members, Assembly Bill 519. Mr. Florence?
Thank you, Chair. Davis Florence for the record. Assembly Bill 519 creates a separate chapter of the Nevada Revised Statutes governing certain agencies and organizations that provide non-medical services. This was sponsored by the committee and heard on April 7th. AB 519 creates a new chapter in NRS consisting of provisions for the licensure and regulation of agencies to provide personal care services, employment agencies that contract to provide non-medical services relating to the personal care of elderly people or people with disabilities, and intermediary service organizations, among other provisions. There was an amendment submitted by Dylan Shaver, the managing partner of Pinion Public Affairs, that is attached, and it proposes to add in subsection 1A of section 30 that regulations must be adopted prescribing mandatory training for family caregivers. Second, it makes a corresponding change in section 122 by removing the requirement that family caregivers complete training required by the Aging and Disability Services Division and instead require such family caregivers to complete the training required by Section 30. And finally, it revises Section 120 and makes the related changes to allow a Medicaid recipient to receive reimbursement for services provided by a family caregiver as a personal care assistant. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gray. Is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give this statement to Assemblymember Hibbets. Next on our agenda, Assembly Bill 520. Mr. Florence.
Thank you, Chair. Assembly Bill 520 revises provisions relating to adoption. This was sponsored by the committee on behalf of the Joint Interim Standing Committee on Health and Human Services and was heard on April 2nd. AB 520 codifies regulations that require the Division of Child and Family Services to investigate the background and personal history of every initial application for a license to operate a child placing agency, as well as every employee, volunteer, and independent contractor of an agency. These investigations must be repeated every 5 years. This bill also authorizes DCFS to release certain information from the state register for adoptions without the written consent of the natural parent if extenuating circumstances exist. And finally, AB 520 authorizes prospective adoptive parents and the representatives of the agency that's responsible for supervising the child to attend a court hearing concerning the adoption through any remote technology system. An amendment was submitted by Marla McDade Williams, the administrator of DCFS, in collaboration with the Department of Public Safety, which proposes an amendment to replace in subsection 7A of section 3 and additionally subsection 1C of section 4, criminal history or a history of child abuse and neglect with substantiation of child maltreatment in the central registry or other information. And it additionally removes the following 4 items. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions? Seeing no questions, I'll entertain a motion to amend and do pass. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. We'll give this floor statement to Assemblymember Gray. Next on our agenda, we have Assembly Bill 521. Mr. Florence.
Thank you, Chair. Davis Florence for the record. Assembly Bill 521 revises provisions relating to the protection of children, and this was sponsored by the committee and heard on April 4th. AB 521 requires an applicant for a license holder, and certain employees and independent contractors of certain facilities and organizations to provide written authorization for the release of any information from the preceding 5 years that may be stored in the statewide central registry for the collection of information concerning the abuse or neglect of a child. This information is used to determine whether there has been a substantiated report of child abuse or neglect. Assemblymember Brown May proposed an amendment to add in subsection 4D of section 5 a requirement to release that information as well as any other equivalent registries information for the preceding 5 years. Thank you, Chair.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. A motion by Assemblymember Gray, second by Assemblymember Hunt. Is there any discussion on this motion? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay. Motion carries unanimously. Thank you. We'll give this floor statement to Assemblymember Anderson. The last item on our agenda, members, is Assembly Bill 522. Mr. Florence.
Thank you, Madam Chair. Davis Florence for the record. Assembly Bill 522 revises provisions relating to health care and was sponsored by the committee and heard on April 7th. AB 522 aligns Nevada law with federal law by requiring a health insurance policy that provides coverage for dependent children to make coverage available until the dependent turns 26 years of age. Additionally, this bill requires public and private health insurance policies, including Medicaid, to cover certain preventative health care services as required by federal law or recommended by the United States Preventative Services Task Force and the Health Resources and Services Administration. Members, there are 3 amendments that have been submitted for this bill. The first, submitted by Jennifer Atlas on behalf of the American Cancer Society Cancer Action Network, which proposes to first remove in any section concerning exposure to ultraviolet radiation, the provisions relating to fair skin types. Second, it removes in sections concerning the tobacco cessation programs, the provisions limiting services to not more than 2 cessation attempts per year and 4 counseling sessions per year. And third, it revises in the sections that concern lung cancer using low-dose computed tomography, that guidelines should be published, or to use the guidelines that are published by the American Cancer Society or USPSTF instead of the current guidelines in some subparagraphs 1 through 3. The Second Amendment, which was submitted by Ryan Beeman on behalf of the Professional Firefighters of Nevada, generally proposes revisions to Section 17 through 29, governing policies of group health insurance to remove in Section 18 concerning exposure to UV radiation, the provisions requiring educations to be covered. Sorry, starting over on that. Remove in Section 18 concerning exposure to ultraviolet radiation and the provision requiring education to be covered, and reduce the service age of coverage to 24 years of age. The fifth item, remove in Section 18 the screenings, tests, and counseling for other health conditions and diseases as recommended by the Health Resources and Services Administration as of January 1st, 2025 for the insureds who are less than 18 years of age. 6, remove in Sections 19 through 25, Section 27 and 29, the provisions prohibiting an insurer from penalizing a healthcare provider for providing a benefit. 7, removes in Section 19 the provisions for screening of asymptomatic bacteria for pregnant insureds and annual screening for urinary incontinence in women. And finally, number 8, exempt a group health insurance policy provided by a governing body of a local government pursuant to NRS 287.010 to persons who have retired from employment with or as acting as an officer of that local government. And then the Third Amendment, which was proposed by Chelsea Capurro on behalf of the Griffin Company, which is also attached, and proposes to remove provisions requiring coverage for medication to prevent breast cancer for insureds who are at high risk of developing breast cancer and have a low risk of adverse side effects from the medication. And then finally, remove the screenings, tests, and counseling for other health conditions and diseases as recommended by HRSA. And that is it, Chair. Thank you.
Thank you, Mr. Florence. Members, any questions on this measure? Seeing no questions, I will entertain a motion to amend and do pass. So moved. Motion by Vice Chair Nguyen, second by Assemblymember Gonzalez. Is there any discussion on this measure? Seeing no discussion, all those in favor say aye. Aye. Any opposed, nay? Will the nays raise their hands, please? Assemblymember Hafen, Assemblymember Hibbets, Assemblymember Edgeworth, Assemblymember Koenig, and Assemblymember Gray. Motion does carry. Thank you, and I will take that floor statement. Great work on the work session. Thank you. That concludes our work session for today. That leads us to the next item on our agenda, which is public comment. If you would like to offer public comment here in Carson City or in Las Vegas, please come forward at this time. Seeing no one, AVH, is there anyone on the telephone line who would like to offer public comment today?
If you would like to provide public comment, please press star 9 now to take your place in the queue. Again, if you would like to provide public comment, please press star 9 now. Caller with the last 3 digits, 133, please press star 6 to unmute your phone. You may begin.
Good afternoon. My name is Charles Stegmeyer, and I'm speaking today as a representative of a privately owned nonprofit cemetery that has served our community for generations. We appreciate the intent of AB 350 to ensure cemeteries are safe and maintained, but I believe the current language in the bill needs serious revision to avoid unintended consequences. First, the bill uses terms like maintained and safe without clearly defining what they mean. That kind of vague wording creates confusion and leaves cemetery owners vulnerable to lawsuits based on personal opinion rather than real standards or violations. Excuse me. Second, AB 350 would allow any family member to sue a cemetery if they feel it isn't maintained properly. This could open the door to lawsuits over things like dry grass in the summer or an older headstone showing normal wear. Most cemeteries, especially nonprofit like ours, operate on limited budgets and try our best to honor every family with respect. This bill risks punishing those who are doing good work under tight constraints. We are good people doing a difficult job for sacred spaces, often with minimal resources and maximum emotional weight. Our staff shows up in all kinds of weather, helping families through the worst days of their lives and keeping history and dignity alive for future generations. Finally, I'm deeply concerned about the provisions allowing the court to transfer cemetery ownership if it finds the current operator isn't serving the public interest. That's a huge risk for a nonprofit cemetery like ours. We're not corporations, we're community organizations with historic ties and limited means. Forcing a transfer without due process or clear evidence of actual harm would be devastating. We truly want to work together with families, the legislator, and our board community and our broader community to continue improving our cemetery and preserving its history. Collaboration and open communication are key. We believe in accountability, but it should be rooted in fairness and clear expectations, not vague legal language that creates fear and confusion. I urge the legislation to define terms like maintenance and safety more clearly, require that any lawsuits be based on actual documented problems, not personal dissatisfaction.
Thank you
Protect
so much for your
nonprofit and
comments. I
historical
appreciate that. We are over the 2-minute limit currently. You're welcome to submit written comments for additional time if you'd like. AVH, is there any other caller?
Chair, there are no other callers to provide public comment at this time.
Thank you, AVH. Members, as we get ready to close today's meeting, I want us to come together to offer a great, big, huge appreciation for all of our staff that have worked so diligently to get us to this time. Our policy analysts, our legal support, our committee secretaries, everyone who makes this go around in the building has worked long, long hours in order to get us here. So please join me in offering congratulations to each of them. And with that, we are adjourned.